Good evening. My name is Dr. Geeta Madhuri. May I know your name and age, please? I'm Satvika. I'm 23. Today I'll be performing some hearing test. Will that be okay for you? Yeah. Now I'm going to start with simple hearing test. I'm going to stand behind you and speak three different numbers into each ear, and I want you to repeat it back. Will that be okay? Okay. 60, 41, 23. 60, 41, 23. Now I'm going to place a stinging fork in the middle of your forehead. Let me know whether the sound is best heard at the left ear or the right or in the middle. Okay. I can hear in both ears. Okay. Now I'm going to place a tuning fork on the mustard bone behind the ear. Let me know when you no longer hear the sound. Okay. I can hear. Now I can't. Now can you hear it? Yes.
Hi, my name is Samisa Rawatama. May I please know your name and age?
I'm Sindhu and I'm 23 years old.
Okay, I'm one of the medical students and today I would like to examine your ears, and if it's okay with you, can I proceed to check?
Yes, you can proceed.
Before that, can I ask you a few questions?
Yeah, sure.
How is the hearing?
It's been going good.
Have you had any trouble with your ears?
No.
Have you had any experiences with pain or tenderness?
No.
Can you please smile for me? Okay. By asking the patient to smile, we can look for any kind of any facial weaknesses, since it's one of the cardinal signs of the ear disease. Now we begin by inspecting the external ear and check for any kind of skin color changes and observe for the size and shape of the pinna, and also look for any kind of abnormalities like congenital defects, skin lesions, or any kind of scars. Then we have to press on the tragus and see if there is any kind of pain or tenderness. Now I'll be using the otoscope to visualize the patient's ear canal and the tympanic membrane. There are different sizes of speculum for the otoscope, and we have to use the largest possible size for the patient's ear canal so that maximum amount of light can enter the ear canal and the tympanic membrane. Now if we are observing the right ear, then we have to use the right hand and hold the otoscope like a pen between the thumb and the index finger, while the pinky finger extends and rests on the patient's face. While the left hand is free, we have to gently pull the pinna upwards, outwards, and backwards in order to straighten the ear canal to better visualize the tympanic membrane. And while doing so, we have to also observe the earwax and for any kind of discharges and inflammations. Now using the same steps, I'm going to examine the left ear. And after inspecting the ear canal, we have to gently proceed down the canal until the tympanic membrane is seen and identify its landmark.
Hello, good day. This is Dasari Saishri. May I know your name and age, please?
My name is Reshma, I'm 22 years old.
Okay. Today I'm going to perform examination of nose. Is that okay with you? Okay. This will involve me looking and feeling the outside of the nose and gently looking inside of the nose. Is that okay with you?
Okay.
Now I'm going to inspect your nose and evaluate size and shape. I'm looking for any scars, asymmetry from front and then from sides. Inspect for any deviation in the nasal bones or cartilage suggestive of any fracture. Now I'm sanitizing my hands to examine the anterior part of the nose. Ask the patient if there is any tenderness. Now I'm going to lift the tip of the nose to obtain a better view, and with the help of the pen light, now I'm observing the color, texture of the skin and looking for any lesions, scars, and with the help of a pen light or otoscopic light, I am looking inside the nostrils. Inspect the nasal mucosa, including the septum, for any abnormalities. Inspect and compare nasal cavity alignment. Choose the largest size speculum possible for the patient. Now, with the help of otoscope with a large speculum attached, assess nasal vestibule, nasal septum and inferior turbinates. Look for any inflammation, ulceration, polyps, asymmetry, deviation or hematoma and epistaxis as well. Now, gently palpate the nose and then check for any mass or any swelling and for any specific area of tenderness. Palpate the nasal bones and cartilage, assessing for alignment, irregularity and tenderness. Test for nasal obstruction if indicated by pressing on each alar nasi in turn and ask the patient to breathe in. Same applies for the other nostril as well.
Hello, myself Fiona, and today I am going to perform the examination of your oral cavity. May I know your name and age, please?
Shruti, 22.
First, I'll be examining the roof of your mouth. Can you please say "ah"? We'll be checking the hard palate for any discoloration or its architecture. Now, for the inspection, I'll ask the patient to protrude the tongue. Now, using a tongue blade, we'll be inspecting the oral mucosa for any discoloration, ulcer, white patches or any nodule. Inspection of gum and teeth. We'll be taking note of the color of the gum, which is usually pink. For the inspection of the gum margin and the interdental papilla, we'll be checking for any swelling or any ulcerations. Now, for the inspection of the teeth, we'll be checking for any missing, discoloration or abnormal position.
Hi, I am Alan. I am 12th student. Today I am going to examine your tongue. Is it okay for you?
Okay.
Can you please tell your name and age, please?
I am Siva. I am 22 years old.
Now I am going to inspect your tongue. Can you please pull out your tongue? Okay. The color is normal. The texture of the dorsum is normal, and there is no asymmetry. The tongue is symmetry. I just checked the entire oral cavity. There is no nodules. There is no ulceration. Now I am going to palpate your tongue and just hold the tip of your tongue. Is it okay for you?
Okay.
Can you please pull out your tongue? Okay. I didn't feel any indurations in your tongue. I am doing the same procedure with the other side. Okay. Okay. Can you please pull out? There is no any indurations I feel. Now I am going to inspect your pharynx. I am just using this tongue depressor on your mouth. Is okay for you?
Okay.
Can you please open your mouth? Can you please say ha? Okay. Your soft polarity is rising while you are saying the ha. So that is normal. And I inspect your soft palate, anterior, posterior pillars, and tonsils and pharynx. There is no any color changes. There is no ulceration or fillings. There is no tonsillar invasion. Everything is normal. Okay. Thank you for your question.
Hello, this is Dr. Bindu Bhargavi. Today I am going to examine the neck. Is that okay for you?
Yes.
Can I know your name and age?
Myself Anuradha. My
Okay.
age is 24.
Okay. Now I am going to examine your neck. I'll be just looking for any scars, symmetry, color changes, massive swelling. Okay. Now I'll look for enlargement of parotid and submandibular gland. Now I will be going to palpate the lymph nodes of the neck. First I will go with preauricular. Next posterior auricular. Then occipital. Then tonsil. Submandibular. Submental. And then superior auricular. Lymph node. Posterior auricular lymph node, deep cervical lymph node, and supraclavicular lymph node.
will be going to inspect the neck for thyroid gland. Looking for contours of the thyroid gland.
Now I will be inspecting the trachea. I will be observing and I will be palpating for any deviations. Now with the help of my index finger, I will be placing my finger between the sternoclavicular muscle and the trachea, and I will be observing the space. And I will be processing the same process in next side. Okay. Now I will be asking my patient to sip some water and extending the neck towards backward. Now I will be asking my patient to swallow the water. I will be observing the movement of thyroid gland, thyroid cartilage, corticoid cartilage, and the thyroid gland will be coming upwards and again coming back to their position. Okay. Now I will be going to palpate the thyroid gland. Can you please sip some water? Can you please swallow it? Yeah.